All right, let's jump right in. If you're navigating kidney disease, the whole world of nutrition can feel like a minefield of restrictions. Don't eat this, can't have that. But what if we flipped that script? What if we shifted the focus from what you can't have to what you can strategically choose? Because today, we're not talking about restriction, we're talking about precision. And that brings us right to the central problem, what you could call the renal diet paradox. You're told to eat healthy, right? To load up on antioxidant-rich foods. But here's the catch. So many of those super healthy foods are also super high in potassium, which can be really dangerous. And this is the balancing act we're talking about. It's a constant nutritional tightrope. On one side, your body is screaming for these powerful nutrients, like antioxidants, to fight off disease. But on the other, you absolutely have to keep that potassium in check. So what do you do? So why is potassium such a huge deal? Well, the big risk is a condition called hyperkalemia. And all that means is that there's too much potassium in your blood. It sounds simple, but it's really serious. It can literally mess with your heart's electrical signals and lead to some dangerous, even life-threatening heart rhythms. This is the main danger we are trying to manage here. Okay, so here's the crucial point. The answer isn't just avoiding everything. It's about finding that nutritional sweet spot. We're looking for foods that are low enough in potassium to be safe, but also packed with enough good stuff to actively help you defend your health. It's about being smart, not just restrictive. To find these foods, we can't just guess. We need a system, a set of rules. And that's where this 5-point safety check comes into play. It's the exact framework we use to identify every single food we're about to talk about. So let's quickly break down this checklist. First, and this is totally non-negotiable, it has to have a low potassium load. Second, the food must have proven anti-inflammatory properties. Third, it needs to offer some kind of heart protection. Fourth, low phosphorus is a must. And finally, number 5, it needs to have good fiber content. Every food we'll discuss from here on out checks all 5 of these boxes. So, with that framework in place, let's get to the good stuff. Ready? Here are the 7 strategic superfoods that made the cut. First up, an absolute classic, the apple. So simple, so versatile, and you know what? It's incredibly effective for a renal diet. Now, this is where it gets really cool. This slide mentions the gut-renal axis. Sounds fancy, but the idea is simple. The special fiber in apples, called pectin, doesn't just help with digestion. It actually latches onto toxins in your gut, stopping them from being absorbed in the first place. That means less work for your kidneys. Next on our list, we have blueberries. Don't let their size fool you. These little guys are absolute nutritional powerhouses. I want you to think of blueberries as your personal cellular defenders. They are just loaded with antioxidants called anthocyanins. These guys directly fight something called oxidative stress, which is kind of like cellular rust, a key factor that can actually speed up kidney damage. And they do all that with a very low potassium price tag. All right, moving on to another amazing berry that makes the list, strawberries. Strawberries offer what you might call broad-spectrum protection. They've got this special compound called ellagic acid, which is showing a lot of promise for protecting kidney function. Plus, you get a fantastic dose of vitamin C without the crazy high potassium you'd find in something like an orange. It's a win-win. And the final berry in our strategic lineup is cranberries. Cranberries are your infection shield. Urinary tract infections can be especially dangerous for kidney patients. Well, the unique compounds in cranberries make it super difficult for bacteria to stick to the walls of the urinary tract. It's like they make the walls too slippery to hang on to, which helps stop infections before they can even start. Okay, let's switch gears from berries to something a little more tropical, pineapple. The secret weapon in pineapple is an enzyme called bromelain. It's a natural inflammation fighter. But that's not all. Pineapple also gives you manganese, a mineral that is really valuable for bone health, which, as you know, can be another area of concern for many kidney patients. Our 6th strategic food might be a favorite for many, red grapes. Think of red grapes as the guardians of your vascular system. They have resveratrol, which you've probably heard of for its heart health benefits. It works by protecting the delicate lining of your blood vessels. And keeping those blood vessels healthy and open is absolutely critical for preserving whatever kidney function you have left. Okay, so we've covered 6 really powerful fruits, but what about something that's also incredibly hydrating? Well, this brings us to a bit of a special case.
Watermelon. Now, because it's almost all water, the potassium per serving is actually very low. It also has lycopene, which is a fantastic antioxidant for your heart. But, and listen, this is a really big but. If you are on a fluid restriction, you absolutely must count watermelon as part of your daily fluid intake. It's not just a food, it's a liquid. That's the strategic caution you have to remember. So after looking at all these individual foods, let's pull back for a second and see the bigger picture. This whole thing is about giving you a strategic advantage in managing your own health.
This matrix here really brings it all home. You can see at a glance that these fruits are not one-trick ponies. Not at all. They deliver multiple, overlapping benefits, all while staying safely inside that low potassium zone. We're talking about synergistic protection. This right here is the main takeaway. For so long, the renal diet has been defined by its limits, by a long list of no's. But this approach completely reframes it. It's not about what you can't eat. It's about having a short list of powerful, strategic foods that you can eat to actively protect your body. It's about empowerment. By bringing these superfoods into your diet, you're not just dodging a mineral, you're actively fighting inflammation and supporting your heart. You're playing offense. So the only question left is, what's your next strategic choice going to be?